just in
I was trying to
time, huh?
remember where this music comes from. I think it's from maybe it's Aaron
It
Copland.
sounds like Aaron Copland, yeah.
See, Doctor Tripp is a man of the world.
Man of arts, man of culture.
Yeah, I have a somehow I ended up with an Aaron Copland CD years ago, and I think that's where I remember it from. Don't know how I ended up with it, but I
Yeah,
like
I
to.
came to appreciate Aaron Copland by being part of a college dance, folk dance team. And one of the routines they did was what's called Appalachian Spring. And then I later had a humanities class
Which
that I.
contains that old from the Shaker culture, right? That there's a it's embedded in Appalachian
It
Spring.
is, yeah, and it's kind of a hoedown type of feeling. But yeah, Aaron Copland, one of our great American composers, and let's see if I'm on with you. I
But
am.
is it, you know that all that dancing kept you in good shape?
It did.
Yeah.
I'm trying to get back into good shape. In fact, we may talk about that in the next few weeks. A lot of times you'll hear radio hosts that get involved with a diet program or this or that, and going to show how they lose weight, and some do it and some don't. I'm hoping to be in the some do it group, so we'll consider that in
And
the,
I'm
future.
working on it with one of your friends. So
Okay, you are, yeah.
yeah.
See, it's I, I'm way ahead on this stuff.
We have a lot
So
to talk about today.
we do. I have a title: rashes, dry skin, and hand, foot, mouth. So we're going to talk about things that are going on right now in our community and things that have to do with illness, but also just generally welcome to winter type things and how it affects our skin, baby skin, everybody's skin.
And you notice that too because when you wash your hands, I was at Winco yesterday and I used the men's room and I washed my hands and I used the air dryer. But if you
Yes,
don't get them completely dry and you go back outside into that dry, cold air, that's where you really start to have some of those issues.
tears you up pretty good. No, I have, classically dry skin. This is something that I guess made me interested in what we do about skin stuff. But about once a week, I'm fighting cracking knuckles that bleed if I don't take care of it. And the fun is I've got some good answers and solutions from my own bad experience.
Can it
And
can it lead to an infection if you have a lot of those little?
absolutely, no.
Wow.
As soon as you get a crack in the skin, it's an invitation for outside invaders to take hold, and so you can absolutely get a skin infection just because you have dry skin, so to speak.
No, when you go down certain aisles, I mean, there's all sorts of hand lotions. Some aren't very expensive, some are. I have a friend, he has a dairy farm, and he swears by this Neutrogena that he's been using for, gosh, 35, 40 years. And says that he heard about it on Paul Harvey's program way, way back. And he sticks with it. And he said it really helps his hands because he's in and out of so much different weather.
That really is true. We have lots of good products that are out there. When I first had our children, there was a product. There's a product still around called Eucerin, and I've since kind of turned away from it a little bit because it's kind of half of it is petroleum jelly, which can be very irritating to sensitive skin. But for the most part, it saved my newborn or 4 month old that had all these little patches all over her, and we just had to slick her up about 4 times a day to keep her out of trouble. And then it'd get good, and a week later, after we got lazy, they started showing up again. So I learned about maintenance on eczema is probably the word we use most typically with those dry patches. But I give you a good idea. Let's stick with the dry skin. I was gonna not gonna start there, but dry skin is what it says. It lacks oils, and so we often are looking for something that will replace those, or at least keep the surface moist. Um, I will often combine an oil type uh, treatment with Vaseline on top of it. The Vaseline is excellent as a moisture barrier. It does not bring moisture to the skin. So here's a good example. We get a kiddo with a diaper rash or especially diarrhea that's just tearing up their bottom while they're wearing a diaper. One of the tricks is you clean that off after they've had their bowel movement and you slick them down with Vaseline. The Vaseline is not moisturizing, but it avoids the acidic nature of the diarrhea from tearing up the skin more. So Vaseline is very good, or petroleum jelly, very good at providing a barrier. But first, you need to apply moisture, and so we're going to talk about options for that.
We got about 50 seconds before the break, but we've got a caller, and what we'll do is allow the caller to get the question out and then get to it on the other side of the break. And caller, you're on the air with Dr. Tripp.
Doctor, antibacterial soap for hand washing or just soap and water, which is better? Thank you very
Amen.
much.
That's a great question. I'm going to give you a long answer. The short answer is just the plain soap and water, not the antibacterial. But after we come back, I'm going to give you the longer version.
And for those of us who do end up washing our hands a lot, that's a very good question.
It is.
Uh, because this time of year we do wash because we don't want to get all of those. We don't want the flu and colds and things like that. More with Dr. Jonathan Tripp coming up in just a moment. It's 8:40. Right now we're at 21, on our way into the mid 30s today, and it looks like a big meltdown coming with the ice and snow. Hallelujah. We've got another 20 minutes with a doctor, and you're listening to, of course, Better Health with Tripp Family Medicine. And remember, life's too short not to feel good. Our last caller brought up a question about the difference between using antibacterial soaps and then just using a regular soap for hand washing. And you had a short answer, and then you said there's a bit of a longer one.
Yeah,
Dr. Tripp, by the way, willing to take your telephone calls here and at the office.
you bet. In fact, should I tell them the office number? Area code 208 933 4400. 933-4400. And I don't really own the Ask a Nurse program, but I'll tell you what, I got enough nurses you can ask. So they're really, and they're smart. That's the good news. And we have had some people worry about, can you get in to see us? So I want to just reiterate that if you're sick or you're hurt, call us. And our object is to get you in same day or at least the next day if for some reason we really can't. So like if you call at 4:30 p.m., it's probably not going to be the same day, but we've got three of us most days that are there, and we'll fit you in, especially if you need it now. Um, Let me go back to the caller's question. Antibacterial soap or just plain regular soap and water? And the answer is plain soap and water. And what's really interesting is that the Centers for Disease Control have stuck with saying for the average person, not hospitals, but for the consumer level, that it ought to just be plain soap and water. But we've had such a big push on antibacterial soaps for the last decade that it's interesting that it's backed off, and they're saying it really doesn't kill the bacteria so much as soap is what's doing the work of having it fall off. You're having it slide off and getting rid of the bacteria that way. So the soap and water is the key. The bad news is what the antibacterial product that's in it, called triclosan, um, it is known to be irritating to skin. So if you're, a healthcare provider or somebody else is washing their hands 100 times a day, that antibacterial is just tearing you to pieces. And, then you get to have the conversation we're having about dry skin. And on top of that, the concern is that this is training our common bacteria to be resistant to at least that antibacterial product. And so, therefore sets us up for worse and worse um, bugs that are trying to, take over our bodies. And in medicine, we see that a lot now, where we have resistant staph, that is the most common skin infection. We have a bacteria called VRE, which is a resistant bacteria that we have no good treatment for. If you get VRE, either your immune system fights it off or you die. So it's a serious thing to say, oh, just use antibacterial stuff all the time. So I'm really happy to see that FDA has come out and said no more, and the manufacturers actually have a year to stop putting it in the product. So you'll still see it on the shelf, but for the most part, the answer is plain soap and water is everything you need, and it'll help us keep out of more resistant bacteria, in my opinion.
And talking a little bit about trouble people have with skin, a lot of it is obviously can be related to weather. It can be related to, you might have an environmental factor. Any number of things can happen, but there's a lot of different causes as to what can actually be behind it.
Yeah, if you get a rash, there's always the question, how did I get this? And a lot of times we can figure it out. If you're feeling ill, if you got a runny nose or a sore throat or a fever, the rash is probably related to that illness, especially if the rash shows up about 2 days after you started feeling ill or getting the congestion. It's probably one of the many common cold viral rashes, and those they can even look kind of like hives. They're usually small, spotty. They're not big. What hives are called wheels. They hives raise up and look almost like a mountain plateau that you can see it raise up. But most of the viral rashes are small little bumps. They're usually pink. They're usually not dark red, and they come and go in a matter of a few days. On the other hand, if you have a sore throat and a fever, especially in a kiddo, and a rash starts mostly around the neck or the chest in that area, and it becomes a sandpaper like rash, feels like sandpaper, that's a go see the doctor because you need antibiotics to treat the strep, not because of the sore throat or the rash, but strep can cause a toxin that will attack heart valves, will attack the kidneys, and put you into lifelong problems. And when the sore throat itself will just go away, but it's the toxins that are being built by that strep that we're really after. So when everybody says, "Oh, I got strep throat, I need to be treated," it's really not about the tonsillitis, even though that's a nice side benefit. It's really more we're worried about long-term heart and kidney issues. Um, we wanted to also talk, as long as we're talking about illness, we're seeing a nice or terrible, whichever way you want to look at it, a substantial outbreak of hand, foot, and mouth right now. So hand, foot, and mouth looks a lot like chickenpox because it comes up as little blisters on the hands, the feet. Often, especially with younger children in diapers, it'll be around the bottom because hand, foot, and mouth is in the saliva. So if you're coughing, sneezing, kissing, sharing glasses, and sharing spoons, things like that, that's how you get it. But it also is in the feces. So it's from contaminated to what's called fecal oral route. Boy, nobody likes to hear that, but the truth is hand washing is key. You can get it from as simple as, grabbing a door handle that's been contaminated and then you rub your eye or pick your nose, or nobody does that, of course.
No,
But
no, never.
but that's how it gets introduced into your own system. Or, maybe a better way like kissing. So pay attention to who you're kissing and see if they're really in trouble.
Those kids do that as a game sometimes on the playground too, and that's where it can come from.
What, the kissing?
Yeah.
Oh, yeah, they don't allow that anymore. No,
Times have
no,
changed.
that's right. No, that's fun. So hand, foot, and mouth is out there. The flu is out there. If you have body aches, and the flu doesn't necessarily give you a rash, but body aches along with congestion, cough, and often a headache, and fever. The fever with the flu this year isn't high. It's usually 100, 101, where prior years it's been 101 plus. So that's one that's pretty common right now as well. So please come and see us. We can help you with that. Going back to this dry skin, olive oil is my cheapest, best treatment for uniformly dry skin, whether it's your hands or whole body. I had a gentleman come in who's well over retirement age who just for the last year has had itchy skin everywhere on his whole trunk, arms, legs, and been to his doc and couldn't get it figured out. And when I looked at it, he just suffers from generally dry skin and find out, he's living in a house like all of us that has lots of dry air, cold, dry air outside and hot, dry air inside, just sucking the moisture out of him, but he doesn't have the ability to replace it just because of the aging process. So my instructions for him are you get to slick down with olive oil every day for the next week and then every other day for the weeks thereafter until winter's over. And I told him, I said, within 10 days, you won't be itching anymore. You will be slick every day, but you will not be itching. And so, that's hopefully we're going to get him away from his back scratcher that he carries everywhere with him.
I
So,
like those things. You
yeah,
can buy them in a lot of different shops.
they do. They feel good, but I could see the marks on his. Um, so whether it's wood stoves, electric baseboards, furnaces, it's all very dry air. So humidifiers are a big deal. If you can do a humidifier, um, uh, especially if you can do one in the main part of the house and a bedroom, that's awesome for yourself or for children. Bathing less frequently. I know the American way is you bathe every day or sometimes twice a day. If you can back off and just do the necessary areas, you'll save your skin a lot if you can, You do it every couple of days or every 3 days instead of every day. So that's a big part of trying to make things better. Um, let's see, what else do we have? Um, I have, let's see, we got the dry skin. We talked about the rashes, hand, foot, and mouth, strep.
Bites from bugs and the like, right?
Oh, yeah. No, we had a great experience, well, unusual experience. From a medical point of view, it's fun to catch things, but a gentleman came in with a rash probably the size of a volleyball on his inner thigh and had no idea where it came from. And it started out much smaller, but grew quickly over about 3 days. And if you stand back and look at it, it actually looks a little bit like a target. So you have red areas and lighter, almost white areas and kind of red bullseye. And that is a characteristic rash that goes along with Lyme disease and usually associated with a tick bite. So you're saying, where did this guy in suburban Twin Falls get a tick bite in the middle of winter? And the answer is, I don't know. And he doesn't know. But it sure looks like it. And it is one that, if you have a target lesion, that needs treating now because it'll go away and you'll never know you had it. And then you can have later problems due to Lyme disease with everything from arthritis to potential increased risk for Alzheimer's. So if you see a rash that looks like a target, let's get you seen. Let's take care of that.
The earlier the better, then, right? I mean, you can treat that early and save people a lot of those later troubles.
Yes, no, in fact, Lyme disease is not a big deal if you know you got it. It's you when you don't know, and over time it can become debilitating. So in the first few weeks, even if he came to me a week or two from now and the rash was gone and said, "Hey, I had this rash and this is what it looked like," I would treat him because it's an easy antibiotic treatment for about 2 weeks, and that's the end of it.
You could now, if someone was out of town on vacation in a warmer climate, you might expect this to happen. But I guess that there's some of these insects that are still living in various hot spots in your home and the like, where you could come across one.
Yeah, no, I am always amazed at how if you go to like a cabin in the winter and turn on the heat and get it going, you all of a sudden have flies. Where did they come from? So yeah, there's a lot of insects that still make it through the winter by being in the house or even by being dormant. And as soon as they get into some heat, life is pretty good there. So where he got that bite, I don't know. Do I know for sure it's a tick bite? Nope. But the look is enough for me to say he deserves treatment.
And I get these sometimes in the summer. They're not terrible, but I've sometimes gotten out of bed in the morning and realized I've got some bites from like a spider on my stomach or, on a leg. And I haven't had any serious issues other than the fact that, it hurts for a couple of days. But those themselves, if they start to grow into some sort of a rash, obviously need some attention right away.
Yeah, there's a shall we say, everything that grows bad is considered a spider bite by patients. They come into the emergency room as I worked in the emergency room and say, I got a spider bite. And never, almost never, I guess once or twice I've had somebody say, I actually saw the spider. But most have never seen it. And it might be a spider. It might be another type of bug. But the reality is usually their bite isn't the problem unless they're a very, poisonous spider. It is usually they've introduced now, they put a hole in your skin and they've introduced the bacteria that was already on your skin. And then that becomes an abscess or a skin infection called cellulitis. And those absolutely, need some treatment.
We don't deal with a lot of them than the brown recluse and things like that they have in other parts of the country.
It's here. It's pretty prevalent actually, but at least from my experience, I don't see it much here. I'm not doing ER for the last 2 years, but prior to that, I was working in Mountain Home at the Air Force Base. And if anybody's going to be out and about and in the sagebrush or whatever, it'd be the people there. And I honestly didn't see it at all. So I know they're here, but luckily I don't see it much.
I had an aunt. We've got a couple of minutes to go, but she was an RN at a state hospital back in upstate New York. And in the early 80s, I had developed, maybe it was my glasses. I had a big frame and they rested on my just at the bottom of my eyes. But I had developed a huge rash on my face, and the glasses irritated it. But I think it was partly caused by a lot of stress I was under at the time. And she just simply said calamine lotion, and sure enough, that cleared it up. It was gone in a couple of weeks.
And honestly, you don't know what it was, and I don't know what it was, but the calamine is a cooling, soothing. And we often use it with poison ivy or poison oak or stinging nettle. And it is not curative, but it is a calming agent, and I would say it's a safe one to use on almost anybody. So, good call by your aunt. So,
It's a little
right
bit
there.
like when you mentioned the Vaseline. It's like getting a driveway sealer on. It protects everything from the elements.
Yeah, no, there's yeah, driveway sealer. I like it. That's kind of my petroleum jelly idea, but yeah, no. In fact, just going back to the skin as a how to protect it, because your skin really keeps a lot of illness out for you. And so moisture is the big deal. Well, how do I do that? How do I get around to it? Because 4 times a day, is really tough to get that done. Uh, I like the olive oil. It's a mess. You don't have to do a lot, but it's a thin coating, and for 10 or 15 minutes, you're pretty sticky. After that, it absorbs in really nicely. So that's my inexpensive way. If you have a favorite one, like you talked about, somebody else swore by their Neutrogena. I have lots of people talk about corn huskers, um, bag balm. There's Gold Bond, this and that. All of those are good. If they irritate your skin, don't use them. But if you have things that aren't responding, come see us. I have some awesome stuff that comes through our cosmetic line that we use on little kids with really bad eczema and has had great results.
And quickly, you're on Facebook and YouTube as well.
Yeah, Facebook is Tripp Valley Medicine, and our website, I couldn't get that word out, is trippvalleymedicine.com. And our phone number, 933-4400. And yes, we're taking new patients. Love to see you.
And we do want to mention we'll get to do this all over again next week with Tripp Family Medicine at 8:30 Wednesday morning. In the meantime, Fox News is coming up in just a moment on Top Story. We've got 21 at 8:59.